tal es Roberto?
Hola, soy Evelyn.
Y Juan Carlos.
Y somos Tercer Cielo.
Hola, ¿qué tal, amigos? Soy Benjati. ¿Qué tal, amigos? Te saluda Funky.
¿Qué tal, amigos? Le habla su hermano Michael Rodríguez.
Hola, ¿cómo estás? Te saluda Marcos Vidal desde España.
Hola, les habla Marcos Witt.
Hola, soy Ingrid Rosario.
Hola, amigos, les habla Harold Guerra.
Todos ellos, sus mejores canciones y muchos más hacen parte de la programación de Aliento Radio. Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.
Hi, welcome back to Avatar Home Health and Hospice Podcast. Today, as we have for the last few podcasts, we have with us Maya Arguez. She's our director of marketing, social media marketing. She's going to help me with this podcast today because I really cannot do a lot by myself. And hopefully you will find this information useful. Maybe not right now. Maybe you don't have a situation where you or one of your loved ones need home health and hospice services or caretaker services. But I'm sure that eventually you will need this type of services, you or someone close to you. So, just listen to us for a few minutes, and I'm sure that after that you will have more information that might be useful for you in the future. So, Maya?
Yep. Thank you for having me. So today we are going to go into home health and hospice and how that can help with patients that are frequently being hospitalized and struggling with rehospitalization a lot. But to start with, why don't you tell us a little bit about you and a little bit about Avatar and what we do?
Well, about me, I'm so old that if I start telling you about me, we need a 2-hour podcast. So since we only have about 25 to 30 minutes, I will just start by saying that we started this agency in 2005. So we are on our 21st anniversary. And we started out with 3 employees, which were like my daughter, who is a registered nurse for many, many years now, my wife, and myself. So we started with 3 people, no patients. God has been super good to us. And today we have 150 employees, and we're helping over 600 families. And when I say families, it's because when we help somebody in home health, hospice, or caretaker services, or even palliative care, we're really helping that family unit. Because if you ever took care of someone that is ill and they're like, say, bedbound, or they need help going to the bathroom, or they're incontinent and you have to change diapers, if you're doing that for more than 8 hours, and then you have the next day and the next day and the next day, you will come to appreciate how much help you need. And we're going to offer you all the help that we can give you under Medicare guidelines. Then, of course, we can also do private pay. But we leave that for the end of the podcast. So we do, like I said, we do home health, we do hospice, we do palliative care, and we do caretaker services or provider services. Now, we do that in the Houston area. So if you're not familiar with Houston and you're listening to us from Miami or someplace else, Amarillo, Texas, I got a phone call the other day from Amarillo, Texas, then I'm sorry for you because I won't be able to help you with your problems, but you will get the information so you can go to a local agency and get that help from them. So we cover all of Harris, which is the county where Houston is, and Montgomery, which is the county where Conroe is, which is basically, 2 large counties I think we're in the southwest of Texas, or south central Texas. I don't know, I haven't checked the map lately, but we're someplace in the south of Texas. And in this territory, in this big area that we cover, we cover about 600 patients we have right now. So
Perfect.
that's the synopsis of the agency.
Right. So why don't you tell us a little bit about specifically home health and hospice and kind of signs that someone might be ready to learn more about the services or inquire?
Well, our services are geared towards geriatric patients. That is, people that are over the age of people who are old, people who are over the age of 65, like me, right? So now there's home health care also for pediatrics, for PEDS, like they call it, but we don't do that. Okay, so there are other agencies that specialize in kids. So we specialize in senior citizens. So as you get older, and if you have a relative or yourself, you know that once you get past 60, 65, you start getting a pain here and a pain there, and they find that you have something here or something there. In other words, your life gets a little bit more complicated because now you have health issues. Sometimes they're minor health issues. Sometimes they're huge health issues. So if you're going to the doctor, say 2-3 times a month, might be for different things. If you feel like you need help, you don't feel confident about getting into your bathtub or going to take a shower by yourself. You look, oh my God, am I going to fall this time? You know, that kind of thing. If you're incontinent, right? So if you have a hard time getting out of the chair, you're watching television and you want to get up, and then you have to ask the angels and everybody else to help you because you don't have the strength to get up. And you have to want one of these things. 1, 2, you know, I've been there. And I hope you're not there, but if you're there, then you need help. So these are all signs, like when you walk, do you have to hold on to the furniture to go from one place to the other one? Because obviously, I'm talking as a senior citizen. Sometimes we're too proud to know that we need to accept the fact that we have to use a cane or a walker. So we don't do that, and then we fall down, and then we break a hip, and now we got major problems. But if any of those things are beginning to happen to you, you need to write down my phone number, which is 281-703-8050. 281-703-8050. Or remember the name, Avatar Home Health. And again, even if you're outside of our service area, I invite you to call me. I don't mind at all. Look at this. I carry my telephone all the time, with me all the time. This morning, somebody called me at 4:45, right? And my luck was the wrong number, right? 5:45. Can you imagine that? Now, my wife was awakened, so now I get it from my wife. So that's a different story, right? But you can call me, and even if you live in other places, I will help you. I'll give you the information. The information does not change because this is a federal program. Home health and hospice are paid by Medicare. So if you have Medicare, you're good to go. Now in hospice, if you have Medicare or Medicaid, you're good to go. 0 copayments, 0 deductibles, no out-of-pocket expenses. So that's important to remember. 0 out-of-pocket expenses.
Right. And another thing that is a common sign that, help could be beneficial is frequent hospitalizations. So if
Oh,
anyone's frequenting the hospital, having a lot of falls, or just any sort of symptoms that are
Right.
causing those hospital visits, then home health and or hospice are huge helps and options in that. So let's talk a little bit about that. When someone leaves the hospital, what are things, let's start with home health. What are things that home health can do to help them?
Okay, so normally once a patient leaves the hospital, he's discharged, most likely the patient is going to be referred either to a rehabilitation, so that means that he's out of the hospital, but he's still going to be an inpatient at an institution, at a rehab, to do therapy and do other things. But once he's finally discharged home, most patients, a lot of patients, do need care at home. Now, that care could be as simple as a nurse going once or twice a week, teaching the patient what medications to take, how to take the medications, making sure he understands whatever his disease is, whether it is high blood pressure or COPD or any of these diseases. He needs to understand what is happening to him so he can address it. Because sometimes we say, oh, I got COPD. I'm going to go outside and drink and smoke me a cigarette. Hey, you already have COPD. Don't push it, right? So you have to understand what is the nature of the illness that you have. You have to understand what do you need to do to get better, and the nurse is there to do that. Now, sometimes they have a wound. So the nurse goes there and does the wound care. Sometimes they have a problem with ambulation, right? It's hard for them to get from the chair to the bathroom. So then they need therapy. So we can bring our physical or occupational therapist, or both of them, and we will help you gain the strength. And ultimately, you might need somebody to help you take a bath because it's not safe for you to go to the bathroom on your own. So we will have a CNA, that is a certified nurse's assistant, to go to your home and help you get a bath 2 or 3 times a week. So in a nutshell, that is what home health services will do for you. And we will do that for you for 1, 2, 3, 4, 5, 6 months until you get back on your feet, until you get back to whatever normal is for you. Because what might be normal for me is not normal for Maya, because I'm like, I don't know, 80 years older than she is. So if somebody's taking care of me and they're giving me therapy and so on, I cannot expect to come to the level when I used to be 35 years old, right? Because I'm not. But I can hope and expect that they bring me to the level that I was at before I went into the hospital, right? So that is home health. Now, home health, like I said, we can help you for a few months, but eventually we're going to have to discharge you. Why? Because Medicare tells us so. Medicare says home health is an intermittent service. Intermittent. Like when you put your turn signal, it goes on and off, and then it stops, right? That's what we do. We go 2, 3 times a week, 2, 3 times, and one day we say, hey, we're going to have to discharge you. Maybe because you're well, or maybe because we're doing the best we can for 4, 5, 6 months, and you're not getting any better. So we cannot continue the treatment because you're not getting any better. Now, if you have an Advantage plan, then it could be that the insurance company tells us this patient is well enough. And we're going to say, no, wait a minute. He needs or she needs our services. And the insurance company says, nah, you help him for a month and a half. That's long enough. And then they stop paying us, so we have to stop our services. So that's home health. And that's why you should call me, because you have all these things with insurances and Medicare and Medicaid, and people don't understand it. And if you call me, I can at least answer your question. I'll give you the right answers. So that's home health. In hospice, that's different. Why? Because in home health, there's the expectation that the patient is going to get better. In hospice, that expectation does not exist. The patient has a terminal illness, and the doctors have determined that no matter what they do, he's not going to get any better. So why continue treatments such as chemotherapy or all those different kind of treatments they got if the patient is not going to get any better? Why have to go to the hospital, to the doctor's office, have an MRI, do this, blood works? So the patient's not going to get any better. So once the doctor determines that, that patient is ready for hospice. And that's where a serious conversation has to take place, a difficult conversation. Normally, I do that with a lot of patients because sometimes the doctors don't make it clear to the patient that, you know, get ready, you won't be with us much longer. I mean, and I'm not oversimplifying it, but that is the fact. And who wants to be told that they're going to die? Nobody. I don't want to be told that. But if I'm going to die soon, 3, 4, 5, 6 months, I would like somebody to tell me so I can make arrangements, so I can say my goodbyes, so I can be at peace with others, right? So I can have like a family reunion. I have one of our patients did that. The lady found out, and she kind of expected it because she had been sick forever. So when the doctor told her, you know, we've reached the end of the road, she said, okay, fine. So when we went to see her at home, I said, well, the first thing I'm going to do after I sign the paperwork for hospice is I'm going to call my family in Louisiana, and I'm going to tell her to organize the biggest family reunion that we ever had. And she did that. I get goosebumps because I live this stuff. You know, I'm passionate about hospice because I see how much good we do for these people and for us. Because believe me, ever since I've been involved with hospice, I'm a stronger person. And I wish that when my time comes, I have the strength and the faith that my patients have taught me, that what they have shown me, because it's unbelievable. So another patient of ours went on a cruise. She had never been on a cruise. And she said, you know what? I've never been on a cruise. I've always been working and taking care of my family. I'm going to go on a cruise. And she went on a cruise. So palliative care is when a patient has a terminal illness. The estimation, the estimate is that the patient is going to live 6 months or less. Now,
You mean hospice care?
I'm talking about hospice care, I'm sorry. So in hospice, 6 months or less. Now, it doesn't have to be, you know, written in stone. We have patients in hospice that have been with us for a year and a half, because you can never be sure about, you know, when the patient is going to die. Sometimes they get better, and we have to discharge them because they got better. Those are the exceptions. But when that happens, we're going to bring that patient all the medical equipment they need: hospital bed, special mattress, bedside table, bedside commode, shower chair, whatever they need, oxygen, Hoyer lift, and everything is electric. We don't deal with this crank. Sometimes I go to patients' home and they have a Hoyer lift, and they lifted a patient that was 250 pounds with a thingy like this. That's crazy. So we go first class. Everything is going to be electric. Everything is going to be first class. Then we're going to bring you all the medical supplies you need, the diapers, the wipes, the gloves, the lotions, the mattress protectors, everything you need, we're going to bring to you. And the medications for hospice. All of that is paid by Medicare. So you don't have to pay us a penny, like I said before. Then we're going to provide you with a nurse that's going to visit you 2-3 times a week. We're going to provide you with a CNA, a nurse's assistant, that's going to come and help you with a bath 3 times a week. We're going to have a visiting doctor to come visit you when you need it. That way you don't have to, because you're not going to be wanting to go to doctor's offices. So we bring our doctor to you. If you need therapy, we'll bring you the therapist also. But in many cases, once you go into hospice, you don't want to do therapy. Some people do, and we provide it for them. But, I think they should spend that time that they do in therapy enjoying themselves, watching television, going around, walk around the block. That's at that stage, that's the best therapy you can have. And we also bring you a social worker that is trained in dealing with you. Not only is she going to be able, is she going to help you with the final arrangements and paperwork that you might need, but she's also going to counsel you and your family, because in most cases, the patient is fine. Hey, they don't like the fact that they're dying, but they accept it. At the beginning, it's a denial, anger process, acceptance, and what have you. But once they get to the acceptance period, that's it. They accept it, they're fine. But their family is not, because they're losing their mom or their dad, the husband, the wife, or in some cases, the children. That in our cases, we adults, but it's still that the mom, that 60-year-old guy is somebody's baby if the mother happens to be alive. And today we have a lot of people that are into their 90s in our services. So we're going to bring you all the services you need. And I almost left out actually what I think is the most important one, a chaplain. Because in home health, we take care of your physical needs. In hospice, we take care of your physical, your emotional, and your spiritual needs. So the chaplain is going to come, and hopefully, if you're a person of faith, she's going to read scriptures to you, she's going to pray with you, she's going to sing with you. Our chaplain is magnificent. And any other chaplain in any other place should be able at least to bring a spiritual peace to the patient. So we have you cover all your needs as far as equipment, medical supplies, medications, nurses, home health aides, and then the counseling for the emotional well-being, the spiritual for the spiritual well-being. So it's a complete service. And then once the patient passes, we don't forget about the family. We stay in contact with them for a whole year. We call them on the phone. What is it? How is it going? If they want our chaplain to go visit them, we send them. The chaplain will go and visit with them. When the patient passes, if they want us to do the service, we do the service. Medicare doesn't require us to do this. But we do this because we are committed to help our patients to the utmost of our abilities. We're committed. Every single one of the 600 families that I'm taking care of, they got my cell phone number, which is crazy. That's why sometimes I get phone calls at 4:45 in the morning, and they go, "Oh, I'm sorry, I didn't mean to call you." Oh my goodness, But that's fine. It's part of my job. I'm doing this because I love it. This is my choice. Nobody's telling me to do it, believe me. So I don't know, Maya. What did I leave out?
So I guess going back to the actual rehospitalizations.
Yes.
So a lot of common reasons for someone to frequent the hospital can be medication errors, infections, falls. So what are things that are either nurses or therapists do that in real time can help patients not have to continue going back to the hospital?
Well, we make sure, number one, that they're taking the right medications. You know that one of the major causes of death for senior citizens in the United States is poisoning by taking the wrong medications. Because they take too many medications for blood pressure, they take one and the other, and they shouldn't be taking two medications together. They forget to take the medication. They take too much of the medication. I mean, it's everything. So our nurses will teach them. We'll go and say, okay, this is how many medications. If they have, we'll make sure they get a pill box. We put everything in the box for them so they know what to do on Monday, Tuesday, Wednesday, Thursday, whatever it is. We help them. We teach them. We go there 2-3 times a week to check on them. We teach their family how to take care of the patient, what signs to look for. What happens when a patient has blood pressure, high blood pressure? Oh, don't call 911. No, don't call 911 yet. Give him the medication that he takes. Wait 20 minutes. No, I'm sorry. Yeah, wait 20 minutes. Do the blood pressure again. If he's still high, give him the medication he takes. Call our nurse. Say our service. Say, hey, the blood pressure is high, and then we might tell you, take him to the hospital. Call 911. If it's a home health patient, if it's a hospice patient, we're gonna go. Our nurse is gonna go to your home. So, yeah, we basically the word is not only teach, like we train the family and the patient to make sure that they're doing things correctly so they don't end up back in the hospital. We teach the family, because normally the family is the culprit of that patient going, because anything happens, oh, 911, oh, let's rush him to urgent care. Oh, we have to teach them that it's okay for a patient to have like a stomach ache. Maybe all they need to do is take Pepto-Bismol. You know, sometimes things are really simple. Sometimes are not. But that's what we provide you with the service. So we say, okay, these are the medications he's taking. These are the diagnosis of the patient. So we know, okay, so when this happens, this is what you need to do. When that happens, this is what you need to do. You know, and sometimes, and some of the things, sometimes you do have to call 911, of course. But we try to avoid sending the patient to the hospital, because I'll tell you what's happening nowadays for the last 10 years. You get to the emergency room. They put you over there. They set you in observation. They take your blood pressure. You know, they might give you a medication or not. They wait until if not changes, they send you back home. Because in most cases, the patient really didn't need to go to the hospital, but the family is so too excited and they take them to the hospital. So the main thing is to pay attention to the nurse, and our nurse is going to be talking to the patient's doctor. So if the family or the caretaker of the patient is paying attention and doing things right, that patient should not be going to the hospital when we're taking care of them. Okay, and we have a good record of that. So now I must say that we take patients that are very, very sick.
Right.
So the patients that are very, very sick or high acuity that other agencies don't want to take because they don't want the trouble of having to take care of somebody that needs a lot of care, we welcome them into our agency. So yeah, just listen to your nurse and to your therapist and follow their instructions.
Right. So let's talk about some misconceptions. So is there any misconceptions about home health that you think would be beneficial to clear up right now?
Well, home health, the one that always comes up a lot is somebody calls me or they call the agency, I get the phone call and they go, well, my mom needs help and I work, so I need somebody here 24/7 because my mom is very sick, and they give me a whole story why her mom or father, whoever, needs 24-hour services. I'm not saying they don't need 24-hour services, but what I tell them is that no one pays, listen to this, no one pays, Medicare, Medicaid, insurance companies do not pay for around-the-clock care. Nobody pays. Medicare doesn't pay. Then of course, this is why they need to call me. Because then when I'm talking about Medicare, it's different than Medicaid. It's different than a long-term policy. So, I'm talking to a patient now that I think it's her father-in-law or something, I'm sorry, to a relative, and one of the members of her family had an insurance that covered him 24/7 if he needed to, because that was an insurance that he got from the company that he used to work for. When he retired, he got a real good policy. They don't make them anymore, okay? So now her mother-in-law or her mother needs our services, but she doesn't have the same insurance. So now she's saying, no, I called Blue Cross Blue Shield. They told me yes. So that's the biggest misconception. They think that they're going to get somebody to be with the patient for hours. That doesn't happen. But then again, call me so I can clarify things for you. And I'll do one more. I'll check the eligibility of your loved one, and I will tell you, based on that insurance company that they use, what services are they going to be entitled to when they need the services. And that way you can get prepared. Because if somebody needs a lot of care, somebody next to them, and they don't have a relative to do that, in many cases, that's out of pocket. That's private care. And now we're looking at, depending on the region where you live, at what time of the day, what day of the week, you're going to pay between $25 to $35 an hour. So, but call me for more details.
Right. So before we wrap up, is there one thing you want listeners to remember from today's conversation?
Yes, there's help out there. Ask for help. Tell your doctor. If you think that you need a nurse, tell your doctor. Doctor, why don't you get me with some home health? Some doctors don't like home health because they have to sign paperwork. And they're very busy, There are other doctors that believe in home health, and they do use home health services a lot. So ask for the help. If you are a senior citizen and you work all your life and you got Medicare, they're not giving you anything. You work for this. You earn it. You pay for it. Every time you got paid throughout your lifetime, starting in 1930-something, they took a piece of your paycheck and the government kept it. And that's your Medicare. That's how they pay for your services. So one thing is ask for help. I run into so many people that need help desperately. They don't ask for help because they think it's going to cost them money. They don't want to bother people. They don't want to accept that they need the help. You have to get over that. Ask for help.
Right.
Call me at 281-703-8050.
Yep. And if anybody wants free resources or wants to learn more about Avatar, you can find us at avatarhomehealth.com. And on social media, we're on Instagram, Facebook, LinkedIn, all at Avatar Home Health and Hospice. And we have some great resources there, but you're probably the best resource to talk to. Give him a call and he's going to be there.
Number one. So anyways, I want to thank you all for putting up with me. I know that sometimes I go off the track and but that's me. So, but I want to thank Maya. Maya, you did a very good job. Thank you. Otherwise, I wouldn't be able to do this. But I invite you to look for our podcast on YouTube and these other places that she mentioned. And on Aliento Radio from Houston. You have to specify Aliento, that is breath in Spanish. Aliento Radio in Houston. And they have all our podcasts in there, and you might find something else that you like, I'm sure. And thank you. Come back and see us again. We love you. God bless you.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial.